All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So, CDC and FDA identify preliminary COVID 19 vaccine safety signal for persons aged 65 years and older. And I'm sure that you have read this news. You have probably looked at this article as well. I want to discuss this in two parts. One is the actual news, the message. Then the other part is my commentary. So, of course, the message that is coming from CDC and FDA is the message that is the public service message. My commentary can be wrong or right. We'll see. I would actually like your opinion for the way I thought about it and tell me if I was correct or not. So let's start. So first of all, here is drbeen.com. And as we are moving from the lifetime to more course oriented, if you want to take the advantage of lifetime for just a very tiny amount, there is a link in the description. You can take advantage of that. We are getting ready to start testing our course-based system, and then we'll go from there and phase out the lifetime. Those who would have the lifetime will grandfather them, but then we would stop selling lifetime. So this may be an interesting time to buy it or to offer it to your friends. And the price is really low. So with this, here is the news. CDC and FDA identify preliminary COVID-19 vaccine safety signal for persons aged 65 years and older. And these are the gifts for humanity that we are continuing with. So I'm going to be very simply presenting to you what they're saying. Then I'll provide the commentary. So here is what they're saying. First, they're saying that, hey, this is the transparency and vaccine safety are top priorities for the Center for CDC. So that is just their more marketing messaging than anything else. I don't think that with these statements, they actually end up adding to their credibility or trust. I think what they did here, for me, it reduced their credibility. So that's my bias here. But let me read what they have here. So they're saying all signals require further investigation. So they have a signal and confirmation from formal epidemiologic studies. Following the availability and use of the updated bivalent. So this is about the bivalent vaccine. And this is also bivalent vaccine Pfizer in 65 plus. So that these are the three important aspects of this: Pfizer, bivalent, and 65 plus. Bivalent COVID-19 vaccine, CDC vaccine safety data link, a near real-time surveillance system, met the statistical criteria to prompt additional investigation into whether there was a safety concern for ischemic stroke in people age 65 and older who received the Pfizer-BioNTech COVID-19 vaccine bivalent. So while you think over this thing, I want to make sure you also see what they are saying as a result. So what the takeaway? So if you said, so what if this is happening? What is the message? Here is the message. Once again, no change is recommended in COVID-19 vaccination practice, which can be found here. So then they have a link to how the vaccination practice is. So keep this in mind that at the end of the day, after saying that, hey, we have a signal, they're saying may or may not be the vaccine, keep going. This is a summary. Now I want to go over this, and if I want to hear what your thoughts are. Let's see. They say rapid response investigation of the signal in the VSD raised a question. Now this VSD is many healthcare systems, hospitals, clinics are feeding their data where this signal is detected. Signal meaning they may have found a higher frequency of the ischemic strokes, higher number of ischemic strokes for the given period of time. So that converts into a signal to say, hey, there is something going on here. Investigate what is going on here. Okay, so rapid response investigation of the signal in the VSD raised a question of whether people 65 and older who have received the Pfizer BioNTech COVID-19 vaccine bivalent were more likely to have an ischemic stroke in the 21 days following vaccination compared with 22 to 42 following vaccination. So within the 21 days, within the 3 weeks, they have a signal that people may be, it's raising a question that people may be getting more strokes compared to the next 22 to 42 days. This preliminary signal has not been identified with Moderna. Now, this is where I want you to think about it, because I'm going to use this message at the end for my commentary as well. So they saw this with Pfizer, or they're seeing it with Pfizer, but not with Moderna. However, they feel nothing needs to change. This preliminary signal has not been identified with the Moderna COVID-19 vaccine bivalent. There also may be other confounding factors contributing to the signal identified in the VSD that merit further investigation. I do not know why they use the word also, because COVID-19 Moderna is not a confounding factor. So they just said that, hey, this is Moderna not having this signal is kind of confusing this side. So we need to see maybe there are other such reasons. So anyways, this is how they are presenting it. Furthermore, it is important. So now they're going to clarify that why do they think it's not needed to be stopped. Furthermore, it is important to note that to date, no other safety system have shown a similar signal, and multiple subsequent analyses have not validated this signal. Now, please remember, when there is a signal, that signal needs to be investigated, not this that, hey, somebody else didn't see it. So meaning if you see a break-in in your home, you shouldn't sit down and say, well, the neighbor's house was not broken into, so maybe I'm okay as well. There is a signal, that signal needs to be investigated. However, they have some clarifications that why they feel it's okay to keep going without any changes to the practice. So they're saying a large study of updated bivalent vaccine from Pfizer BioNTech and Moderna using the Center for Medicare and Medicaid Services database revealed no increased risk of ischemic stroke. So that's one proof that this may be just a confounding factor. This may be something else. A preliminary study using the Veterans Affairs database did not indicate an increased risk of ischemic stroke following an updated bivalent vaccine. So this is their second proof. The Vaccine Adverse Events Reporting System, VAERS, managed by CDC and FDA, has not seen an increase in reporting of ischemic stroke following the updated bivalent vaccine. Then they say Pfizer BioNTech's global safety database, and I would really not consider Pfizer BioNTech to have something to add here because they are the party whose product is in question. Anyways, CDC says Pfizer BioNTech's global safety database has not indicated a signal for ischemic stroke with the updated bivalent vaccine. So Pfizer says that, hey, our database is not showing anything. Okay. Then they say other countries have not observed an increased risk for ischemic stroke with updated bivalent vaccine. The question would be, do other countries have a similar mechanism? So then, although the totality of the data currently suggests that it is very unlikely that the signal in VSD represents a true clinical risk, we believe it is important to share this information with the public, as we have in the past, when one of our safety monitoring system detects a signal. So they're saying we think no issues, but we still want to let you know. They become really very proactive here in telling us. CDC and FDA will continue to evaluate additional data from these and other vaccine safety systems. These data and additional analysis will be discussed at the upcoming January 26th meeting. Believe me, if someone had said to me, if I was in one of these organizations and the directors came to me and they said, we're going to announce that we'll have 26th meeting, we'll discuss it then, I would fire them. Why could they not initiate a more urgent meeting? Just that much? If they're caring so much that transparency and safety and efficacy information is our top priority, well, then show your priority. Have an emergency meeting. Ask them to review it right now. So they're saying, well, upcoming January 26th meeting of the FDA's Vaccine and Related Biological Product Advisory Committee. They did the same thing, remember, with the myocarditis as well, that there was a signal and they said, hey, we'll discuss it in the next meeting. So no change in vaccination practice is recommended. CDC continues to recommend that everyone age 6 months of age and older stay up to date with COVID-19 vaccination. This includes individuals who are currently eligible to receive an updated bivalent vaccine. Staying up to date with the vaccine is the most effective tool we have for reducing death, hospitalization, and severe disease from COVID-19, as has now been demonstrated in multiple studies conducted in the United States and other countries. I think there is a slight word play over here, and that is staying up to date with vaccine is the most effective tool. I believe that we have to not generalize it this way, and we have to be able to say there are some who are at risk and need booster even when its efficacy is not as great. And those who are not at risk, for them, if they have a primary series, they are protected from severe cases, and that is good enough. But of course, they're not going to do that. They're saying, well, up to dated is the right answer. Then they have some data points here, and then they say again, once again, no change is recommended. So this is CDC and FDA. Some more links in the description before my commentary. This is the practice of the vaccine, that what is the schedule and how to give it. Boosters are usually given, I believe, 8 weeks after the primary series or anytime a person wants who is eligible. Then this is some more studies here. Effectiveness of the bivalent mRNA vaccine in preventing symptomatic SARS-CoV-2 infection. I have been of the opinion that symptomatic infection is not, it is important because from a long COVID point of view. However, this is less important than severe hospitalization cases. So anyways, this is a link there. Then strokes. Strokes is the discussion within the 21 days of Pfizer. So in 2020, 1 in 6 deaths from cardiovascular disease were due to stroke. Every 40 seconds, so this is, we're talking about ischemic strokes. Every 40 seconds, someone in the US has a stroke. Every 3.5 minutes, someone dies of stroke. Every year, more than 795,000 people in the US have strokes. About 610 of those are first or new strokes. What I want to convey here also is this, that US's population that is 65 plus is about 54 million, 16% of population. The strokes in the population overall per year in the US are about 800,000 per year. Out of those 800,000 strokes, 3/4 or 75% are in 65 plus. So that is the general incidence. However, when CDC is flagging it, that means they're seeing something more than this. Again, they're saying we're confused yet, we are investigating. So in the meantime, keep going. I saw something interesting in CNN where they said of about 550,000 seniors who got Pfizer bivalent boosters and were tracked by the VSD, 130 had strokes in the 3 weeks after the shot, according to a CDC official who spoke to CNN on condition of anonymity because they weren't authorized to share the data. None of the 130 people died. So this, within 3 weeks, out of 550,000 people, 130 cases may be a higher incidence. So this is the message. I hope the message, even when I editorialize or inserted my comments here and there, I hope the message is there and the link is there. So if I still muddied up the message, you have the link and you can look at this. Now my commentary, and that means this part may be incorrect. I may be thinking wrong, and I would love if you can comment on it, that am I thinking incorrectly? So here is how I was looking at it. Number one, so my impression from their discussion, CDCs, became we have a signal, we think it may be just some nothing to do with vaccine kind of an event. We are going to investigate more. We'll get back to you. In the meantime, keep going. But for the important thing here, this didn't happen with Moderna. And they called it a confounding factor, meaning they said, well, that confused us. It didn't happen there. So that makes it even more kind of sensitive towards Pfizer to say maybe it is something to do with this. So we should investigate. If it was happening to both of them equally, then we would have said, fine, it's the same. But I think for me, if I was making a decision, I would say that, well, one vaccine is not doing it, even if we do not know exactly what is doing it. And the other one is, one vaccine doesn't have the signal, then all right, while we are investigating, have the people who are eligible, who need vaccine, to have the Moderna vaccine in the meantime. 65 plus, how many people would be there? We are majority already vaccinated. So how easy would have this been to say 65 plus, we see a signal, out of abundance of caution, we love you, we don't want you to be hurt. Why don't you take Moderna if you need to? It's equally great. This is me saying from their point of view. And maybe don't take Pfizer yet. We will investigate, we'll come back and we'll let you know if it is okay or not. Would that have caused any issues? Forget about the commercial part, because CDC should not look at commercial side of Pfizer or Moderna. They should look at the people side of it. And how difficult nowadays, wherever you go for the vaccine, normally they have various vaccines. What will have happened? Maybe a few thousand doses may have become wasted because they sat in the storage for 3 months while CDC investigated. So what? It's still lesser than even one person's stroke. So that's one thought that came to my mind as a doctor, as someone who might actually be talking with this team to say, here is how to make a decision. Then they say alternative. So this is me, that alternative Moderna is available. If you didn't have anything else, you would say, you know what? We have nothing else available. This is it. We see a signal. We're working on it. In the meantime, we're going to protect you. So please continue. But they have an alternative. And why risk someone? Even if there is a risk for one person, why risk him? Then this is a very important point that I'm going to make. Someone who has long COVID, someone who gets COVID, becomes hospitalized, has all the coverage available if they're insured. If they get long COVID, that is also coverage available. But we are seeing that somebody who becomes vaccine injured is very difficult to get the coverage. I was actually, a few days ago, I was thinking of Jon Stewart, that we need Jon Stewart to help vaccine injured. And then I saw his program where he talked about vaccine with his guests. But at the end of the day, one of his guests said, we need your help for long COVID patients because they're not getting any attention. And it was such a disappointment for me that they didn't say there are so many vaccine injured who need help as well. That really hit me, because there are a few people I really love. I love Jon Stewart. I love Dr. Paul Marik. And I was disappointed that vaccine injury was just kept on aside. But now if you connect this, If vaccine injured are not going to get much attention, then why to risk them if there is an alternative as well? So that was another thought that came to my mind, considering there have been many vaccine injured patients as well that have been here. And our, as a society, as a system, our our approach is not great. And finally, let's look at this algorithm together, this little tiny algo, and let's see how CDC and FDA can approach this. So they're saying if you continue as is, as they're doing now, what will happen is they're saying, all right, continue as is while we go out and we figure out if the signal actually has any merit or it is actually something related to the vaccine. So what will be the outcome? Either the outcome will be yes, signal has something to do with the vaccine, or no, no damage from the vaccine. This was just a wrong signal. Other factors were involved. So now think about it. If they said continue as is, and then they come back 2-3 months later and say, yes, there was something to do with the vaccine, everyone who has been vaccinated during this time, and if they suffered, that will be because of this decision. On the other hand, if they said, you know what, for the time being, we're recommending Moderna, 65 plus. Then they go and say, we're going to go and investigate. We'll come back to you a week later, 2 months later, whatever, whenever they can. And then if they come back and they say, yes, there was a reason for Pfizer, then look how good they would seem that, hey, they made a very quick, correct decision. They reduced the risk to the population. They went back, they found that there was a damage because of the vaccine, and good, we are moving in another direction. Or they came back and they said 2 months later, 1 month later, they said, you know what, all good. This was not the vaccine. Wrong signal, false alarm. Good. We would still respect and love them because they made a decision to save people during this time. They did not expose them to a risk when the risk was unknown. This is how simple the decision making could have been. So, once again, I showed you what they decided, and that is the decision. That is what they are going to do, and that is what they're saying. But if they came back and they said, yes, it was something to do with Pfizer, and they have come back with Johnson & Johnson and said there is something to do with Johnson & Johnson, we are not recommending it. So if they came back and they said 65 plus, Pfizer, not good. Then from now till that point, everyone exposed to this risk they will be responsible for it. And the solution is very simple, to say, hey, for next 1 month, take Moderna. Anyways, now I'm repeating myself. Please, John says they're just monitoring for now. The thing is this is what happens with the signal. It's not a new thing that there is a signal. We start going and looking for what may be the reason. They start looking at the signal itself, they investigate, then they can come back. They can actually go for those cases as well instead of just looking for new cases. But how bad is this to say, I'm going to watch for more strokes with this to confirm if it is this? Well, you're going to have people have strokes to confirm. So why not in the meantime, you ask for Moderna and you investigate the cases that have happened. Check them out first before saying, I'm going to wait for more. I'm going to see if it is statistically significant. I'm going to do studies on this. That I just don't agree with. So if I have, let's say, my father has passed away, but if my father was here and I had to go get him a booster, after this information, I would have said, avoid Pfizer, let's get Moderna, if at all. And then when there is more clarity, we can decide further. If my own age was this, I would have done the same thing for myself as well. So anyways, this is the discussion. Please like, subscribe, and share. I would like to hear your comment. Let's keep our comments civil and productive. Ideas, thoughts. So I presented my thought. You could say that, hey, don't agree with your thought. Here is my opinion. Or you could say, yes, agree with your thought, and here is an extension. So make it a good civil place where we can actually contribute overall to the knowledge and to the thinking pool of the society, instead of just looking like children fighting with each other. So with this, thank you very much. Please like, subscribe, and share. There are some links in the description. If you would like to support this work, you can buy me a coffee. You can become part of patrons, or you can become a member of Substack. You can become a member of this YouTube channel as well. And we have actually started, for the paid members, we have started Zoom calls every other week. So 1 week we decide a topic. For example, this Thursday's call is going to be the discussion of safety and efficacy. And what does it mean in contemporary time? So that is a discussion. That was the topic voted on. And now I'm going to be preparing for that during this time. And then Thursday we'll do a Zoom call. My benefit of the Zoom call is I don't record it, so we can have an open discussion, and there is no uploading it and editing it and putting it out there. So that is a discussion. Once again, links in the description. And I would see you probably day after tomorrow. Tomorrow we have some guests over. We're going to go to San Francisco, so I will not be here, but I'll see you day after. Please, in the meantime, like, subscribe, share. Good night for now.